Okay, good afternoon. My name is Cathy Bodine, and I have just a few minutes to update you on what we've been working on with our Rehabilitation Engineering Research Center to advance cognitive technologies. Today represents day one of year 10 of the RERC on cognitive technologies. And yesterday we hosted our State of the Science conference for a group of about 50 folks from all over the United States, many of whom are here today. Some are speaking today as well. And I wanted to start out just briefly to give you a little bit of context, and we've been talking about numbers today, but we know that over 1 billion people in this world have some form of a disability, and as Bill just said, about 60% of the folks that live in the United States, of the 57 million, have some type of a cognitive disability or impairment. And this is all increasing rather dramatically. The other context that I wanted to provide for you, these are some numbers, the top two from 2009, the bottom two from 2011, just to give you some notion in billions and billions of dollars of how much money we're spending on disability, or what percentage of our federal funding, our state funding, goes to disability. And as Bill said, this is a trend that needs to be looked at and hopefully reversed in as many ways as we possibly can, and at the same time provide value, independence, and quality of life for everyone. So right now, not to dwell on it, some of us are getting a little bit older. And by 2035 in the U.S., 1 in 5 people will be over the age of 65. We're keeping babies alive that we weren't able to keep alive even 5 or 10 years ago. We're creating disability through war. And lots of things are happening that are causing many of us to live with disability in one form or another. And so that creates some interesting context for us to think about. Now, by 2016, the U.S. market alone for assistive technology is projected to be about $55 billion. That's a very large market. Yet it's a scattered market, and we don't identify very well as a coherent or cohesive market. So those are some of the background things that we're thinking about and things that we're doing. But then it begs the question, what about people with cognitive disabilities? So let's talk a little bit on blazing trails. If we go back 10 years ago, the Coleman Institute's been here with us a little bit more than a decade. And back in the early 2000s, the National Institute on Disability and Rehabilitation Research, with much gentle urging from the Coleman Institute and others throughout the country, said, okay, let's do something about it. So they established this priority for an RERC for cognitive technologies. We've been blessed. Our program has had 2 rounds of the RERC, and we're very excited about that. First in 2004, it was renewed again in 2009. So where were we in the beginning? When we started with the Coleman Institute, and when we started with the RERC, there really wasn't a defined field of cognitive technology. It was just a lot of us out in the field doing the best we could with whatever we could come up with. And that has really changed over the last 10 or 12 years. We can now say there is science going on in cognitive technologies. There's a lot happening. And we're very proud of that because it's all of us combined working together. So at our State of the Science conference yesterday, and I'm going to give you basically a high view. There are a lot of posters here. We're all happy to talk to you. We'll be publishing some information from this conference. But the most important thing I think that came out for me yesterday is that we agree there now is a field of cognitive technologies. And I think that that's something that we should take great pride in, that all of us collectively have helped to create that. There are collaborators across discipline. We have people with cognitive disabilities deeply engaged and their families in this field. We have agencies and institutions. This is growing. I spend, 10 years ago, people didn't talk about cognitive technologies. They didn't talk about the field of. I get calls daily, weekly sometimes, often, asking about what's going on and what can we do. This has been a huge change. We focused yesterday around some major initiatives because in one day, we managed to squeeze in, I think, 14 talks and 30-minute talks, so it was quite packed. But you can't cover everything, right? And to get to Bill's point, a lot of what we're doing is providing and learning and engaging in that information that we need to build this infrastructure of the future. And so our focus yesterday was around social assistive robotics, nonlinear context-aware prompting, product testing, usability, getting towards the notion of standards. All of those things came together. So what are social assistive robotics, and what's happening, and what are our recommendations around that? There's a lot of really cool work. Mohammed Mahur, who I believe is here today at the University of Denver, was at our conference. Our team's been working on social assistive robotics, and basically these are products that really extend the class of definition of assistive technology, because they're products that can be very low cost, they can be very interactive and engaging for people with cognitive and other disabilities, and they really have the potential to support therapeutic interactions. One of the key things, and you'll see it in a number of my slides that we came up with yesterday, is this need for evidence, okay? We now are starting to get the tools. Now we need to develop the evidence that is in support of the impact or efficacy of these tools. The social assistive robotics that are being developed around the world really have a great potential to impact cognition and learning, emotional affect. Dr. Mahur talks about autism, the social engagement, certainly the physical and sensory capabilities of all people with disabilities. So the recommendations there were to really take advantage of the continuing technological advancements in furthering assistive robotics. For example, in the product that we're developing for children with very, very severe disabilities, we're very interested. Right now, we would guess our price point is at $350. We'd like to see that price point down to $150 so that families can figure out a way to afford something like this to augment the interventions their child needs. There is, again, this desperate need to create the body of evidence to really measure the efficacy and the impact of this social and therapeutic model and what is going on. So we want to know what those things are. The other thing we spent a fair amount of time is really talking about product usability. And product usability testing has to do with figuring out what do people, in our case, people with cognitive disabilities, like about products, how do they use these products, what are the barriers to the use of these products, and what are good things about these products that maybe we want to see more of. And again, as we discussed in kind of the high-level conversation around this, is that there is a critical need. It's very critical to engage the end users and the support personnel. Because one of the things we know, and one of the things we're measuring right now, is not just how the person with a cognitive disability engages with technology, but what about their family members? What about the support personnel that have to set it up, that have to make sure it's where it needs to be, because it's not ready instantly right now? How do we make that work, and how do we look at the documentation and the setup for that kind of thing? And how can we take the knowledge we're gaining from all of this product testing that we're doing and have it impact future product design? How do we funnel this information to these Web 3.0 designers? How do we get that going? So those are things that are very critical. And how do we support iterative design changes? There are a lot of products, everyday consumer products, from microwaves to cell phones to toasters. Pick one. I'm in the kitchen. I just ate. So how do we support iterative design changes so that the next version that comes out is just that much better than this version now in terms of being usable by all people, including people with cognitive disabilities? And what can we do for both assistive and mainstream products to make them better? Now, one of the things that everyone in this room is going to see very, very soon, we almost have it ready to go, is an online survey that is going to be looking at abandonment and use of products for people with cognitive disabilities. It's the APAD survey that Dr. Patricia Hine, who I believe is here, is spearheading with our team of the RERC to really look at some of the factors of why people continue to use products and then why they abandon it. So you will be seeing that coming your way soon, and we really deeply appreciate your help. We need 2,000 people to fill it out in order to make us happy. So we would really appreciate your support on that. Okay. So what about nonlinear context-aware prompting? And so if you haven't heard of this, nonlinear context-aware prompting is that notion of having that coach, kind of like Bill was talking earlier, that gives you a hint or a helping hand when you need it, where you need it, in the way you need to be prompted. And so we've been doing quite a bit of work and quite a bit of research on this particular topic within our RERC and some of our friends around the country. And what we really talked about is that the current advances and the immediate advances, where we're going with the technology in sensors and computing capability, this ability to provide real-time direction and assistance, and in our case we've been looking at workplace accommodations currently, it's there, and we can really make this work. But again, we have to have the evidence. We have to understand not only, okay, so we can make it work, that's nice, but how? And what is the best way to go about it? What kinds of prompts do people appreciate, et cetera, et cetera, et cetera, and how impactful is it? Can we help people hold down a full-time job or a part-time job and become tax-paying citizens? We think that that's highly possible, but we need to collect that evidence to prove it. And we also need to determine the role of the sensors and prompts within multiple environments. This doesn't have to just be at work. Obviously, that's our test bed right now, but it certainly could be at school, at home, at play, wherever you need or want to be. These virtual coaches can be there to assist, and we need to really expand the work that we're doing in this area. And then standards, and again, I feel like we're the nuts and bolts behind and underneath Bill's talk, but we're 10 years out to get up all the information we need. But standards are hard, and Peter Axelson's leading our work on thinking about standards development within our group and the things that we need to think about and do. He's worked very closely with Greg McGrew in our usability lab. And it really is in its infancy in terms of all the things you have to think about, because you can't say all the buttons need to be a certain size or provide specifically this input when you touch them. It has to be personalized to the individual. So the thing that's really important is that the usability data that we're collecting with our working groups is really helping to identify these features and functions that might enhance or inhibit the performance for people in certain situations and in certain times of their life or of their day. So the recommendations really is this need to continue the work to generate guidelines to support manufacturers, to enhance product design, and obviously adoption by consumers, which means to enhance the sales of products for industry, as well as being able to publish some relevant information for consumers and providers, because people need to make informed purchase decisions. And how do we present this information in a way that it's usable by everyone, that it's not a penalty, if you will, for manufacturers, but rather it is a guide and a support for all of us. So this is going to be, again, ongoing work that we're engaged in and will continue to engage in. So one of the things that we like to talk about is some outcomes, and one of the major outcomes that I wanted to announce today and talk about is the Department of Bioengineering. So 3 years ago, the University of Colorado launched through the Denver and the Anschutz Medical Campus a Department of Bioengineering through the School of Engineering and Sciences at the Denver campus. So we started our PhD program 3 years ago, the master's program 2 years ago, and we just launched the undergraduate program this year. And so one of the things that has come about as a big result of working with the RERC and everything that we're doing is that we have students knocking on our door who really want to get in this field. And so the Department of Bioengineering and the Department of Physical Medicine and Rehabilitation are combining to create a joint program in rehabilitation engineering. We haven't decided on a final title, but part of what I'll be doing for the next 2 years is developing the curriculum for the undergraduate, master's, and PhD program for this multi-campus endeavor. So we're very excited about that, and it wouldn't have happened without the Coleman Institute and without the RERC that has occurred. So we're looking forward to continuing to grow this legacy of engineers who are interested in disability and technology. So we'll be focusing on, within this program, we'll be focusing on robotics, human factors and usability, you notice the theme here, control systems for disability and aging, and that has so much to do with how people engage with technology, and of course a biomechanical postural support, because that's something that our labs do very, very well already, and really is a part of what happens with disability. So I want to thank NIDR, the Coleman Institute, and our RERC partners and colleagues, of whom there are hundreds around the country and around the world who are working to help us with what we do. So thank you very much.